I'm Dr. Christina Abby. I'm the Clinical Programs Manager at evolvedMD. My background includes psychology and social work. I have a bachelor's in psychology and a master's in social work and a doctorate in social work with a concentration in innovation and management. Here at evolvedMD, I do a lot of the research and curriculum, so that includes staying abreast of what issues are relevant in integrated behavioral health and finding the appropriate interventions for those. I do a lot of new hire orientation for our behavioral health managers. I consistently teach the screening portions and cognitive behavioral therapy for chronic pain patients and diversity, equity, and inclusion. I also manage the company's involvements in any type of grant programs and perform those specialized lunches such as our pediatric programs. There's many reasons why suicide rates have increased in the United States. Some of those reasons are the threats to financial stability that many families have faced over the recent years, the presence of social unrest in the form of protests, in the form of violence and brutality. There's also been a lot of new fears brought on by the COVID-19 pandemic, such as isolation, depression, and anxiety. And also there's been an increase in substance abuse. So it's really hard to just indicate one reason for the increase in suicide rates in the United States. evolvedMD's model addresses suicidal ideations in a number of ways. One way is through the use of the PHQ-9 and the GAD-7 for our adult population. These assessment tools are completed before every session that a behavioral health manager has with our adult population. The PHQ-9 assesses for depression and the GAD-7 assesses for anxiety. If a patient says yes to number 9 on the PHQ-9, which is the question that assesses for any suicidal ideation, then that patient is identified as being a high-risk patient, and then the behavioral health manager follows the safety protocol, which includes completing the Columbia Suicide Severity Rating Scale, completing a safety plan with the patient, giving the patient suicide prevention psychoeducation, and also a list of crisis numbers that the patient can use if they're ever feeling like they're in a state of experiencing those suicidal ideations. Our behavioral health managers, as well as the rest of the staff, stay abreast of the most recent crisis information, which includes things like the use of the new national 988 number. We also utilize the NeuroFlow app, and this is an app that identifies those high-risk patients also, so there's that reinforcement of how we identify patients who may be at risk. This app sends urgent alerts, which our behavioral health managers have access to. Our care coordinators also manage those alerts and communicate with the behavioral health managers to make sure that someone addresses that need with the patients. Also, our management and leadership staff have access to those urgent alerts, and we all receive emails so that the ball isn't dropped anywhere and those high-risk patients do receive the services that they need. The NeuroFlow app also supplies the patient with those crisis numbers. Another thing is our monthly lunch and learns. So for this month, our behavioral health managers did lunch and learns with each of their clinic staff, and it was on suicide prevention. And we also had these handy dandy suicide prevention bracelets to wear to remind everyone to increase awareness of suicide prevention and to reduce that stigma that's usually associated with suicide. One easy thing that people can do to spread awareness and reduce the stigma is to talk about suicide. There is this huge myth that if we talk about suicide, then it will increase the number of suicide attempts, and that is not true at all. talking about suicide actually gives people the opportunity to seek help. It gives them the opportunity to rethink decisions and to also share their stories. And all of those actions help to reduce that stigma. We can also become familiar with the warning signs and the risk factors associated with attempting suicide. People believe that there usually are no warning signs and that it just happens, and that's not true. Usually there's always a verbal or behavioral warning sign that is exhibited before a person attempts suicide. And we can also encourage people who are struggling with suicidal ideations to seek help. And ourselves, what we can do is to be present, to be available if we know someone needs our assistance. So the main thing would be to just change the way we think about and talk about suicide.